question here, and it's from Jacobo from Vancouver. And he asks, good afternoon, Minister Blair. As someone who has a loved one across the border, I'm happy to finally be able to apply to be reunited. My question is, why did it take multiple months to put forward this policy to allow for reunification? And what were your thoughts as this change in the border was being discussed within Cabinet?
And let me assure the questioner, we are not without compassion. And you know, we heard some heartbreaking and compelling stories from people who were separated from loved ones. Some of those stories were quite tragic in their nature because, you know, someone might be dying or to attend a funeral, but families were separated. We had in March to take some really extraordinary measures to keep Canadians safe. Unprecedented and frankly, a very challenging thing is we essentially closed our border to the United States to all non-essential traffic. And I actually developed a list of what would be essential, and it's trades and goods and essential workers. But we worked with people in identifying some of those exceptions. We first of all expanded family reunification. Well, keeping families apart was unacceptable. We then continued to work on it. I will tell you that it was really important that we work with the provinces and territories. And I had multiple conversations, particularly with the officials in public health and in public safety in British Columbia about that border. There was a lot of concern among Canadians generally about any easing of the restrictions on non-essential travel. And we had to make some changes, some exemptions and exceptions for those people under compassionate conditions. And so we needed to put a process in place. And I appreciate very much people's patience and how much time it took to do that. But we worked diligently on this in order to find a way to do it safely, to put a process in place so that people could apply. And it's very difficult, I'll just tell you, when somebody comes to the border and says to the border service officer, you know, I want to come for these compassionate reasons. For the border service officer, in the 1 or 2 minutes they have with that individual to determine whether or not that exemption should be granted. So we built a process that allowed people to apply, to make their case. If they needed medical documents or family attestations or any other evidence to make their case on why they needed to come in, though their travel was somewhat discretionary, but for a compassionate reason, that they could make that case before they came to the border. We had people traveling vast distances and then being turned around. That wasn't acceptable either. We've created this process to allow people to apply, and we believe it can now be managed safely. They'll still have to obey all the public health rules with respect to quarantine, etc., but to keep families together and to respond appropriately to those cases that demanded compassion. And I deeply regret and I understand, and we're, you know, I'm very sympathetic to people that were really under difficult circumstances, but we've worked hard to put a process in place that does two things, that acknowledges that those compassionate grounds, but also it does the things that are necessary to prevent the disease from being spread across our borders. And I will tell you, borders don't prevent absolutely the spread of the illness, but it slows it down. And so the measures that we've taken have been very effective. And I think if you look what's going on in the United States, you can see that we've done a pretty good job protecting Canadians from those same terrible outcomes. But we also recognize the importance for international students, for family reunifications, for compassionate reasons, to try to help people be together.
I think, Bill, you know, you're just underlying some of the difficulties here. I mean, COVID-19 is something that many of us have never experienced before. I think the crisis the last big crisis was World War II, when people had to sacrifice their own personal security and their own personal lives in order to protect others. But I think the thing about COVID-19 is that I think the question about why did it take so long is because this particular virus has been changing. We were learning about this virus like every week something new was coming up, and people were trying very hard to protect Canadians from getting infected from across the border, and at the same time trying to protect their ability to want to meet with their families and keep this. That was a difficult, and it still will be a difficult balancing act.
And Hedy, I'll just share a quick story about that. Back in March, we were looking at the infection rate was starting to go up. Particularly, you'll recall, in Washington State, there were a number of of outbreaks that were taking place in long-term care facilities and among healthcare workers. And there was a very real concern in British Columbia. And I heard immediately from the health minister, Minister Dix, from Mike Farnworth, from Bonnie Henry. They were really concerned about the illness transiting across the border in British Columbia. And so I'll tell you, just based on their ask for help, I phoned my counterpart, the Secretary of Homeland Security, and I said, what do you think about closing the border? And he said, what do you mean? And I said, well, just for non-essential travel, because we have to keep supply lines going, we've got to put food on the shelves, and essential workers have to, but to just stop non-essential travel, what we might call discretionary travel. We had that conversation about 10 o'clock on a Tuesday morning. On Wednesday, the next day, less than 24 hours later, the Prime Minister and the President of the United States announced we were closing the border. Extraordinary. The pace of that closing was breathtaking and unprecedented. All of the changes we subsequently made, not to ease the border, but to modify those restrictions to account for compassion. We've never relented in our commitment to keep people safe. But we've tried very hard to manage this. We're bringing forward orders in council. Again, I know it's been difficult for people. This pandemic has impacted everyone's life.